Hey everyone, Melissa Rose here. I want to share something with you that I find often in my practice, as well as something that I am dealing with myself. One of the things that I find often when I have clients come in with certain symptomology is that no one has ever looked at their iron, ferritin, and TBIC, which is the ability of the body to actually use iron and create new red blood cells with it. So I'm going to really talk you through this. The symptomology that we're going to be really referring to today is fatigue or weakness. Think about all of the disease processes that have this as a central symptom, right? So fatigue and weakness, pale skin or pallor, shortness of breath, can't get enough oxygen, dizziness or lightheadedness. Or if they start to exert themselves at all, they get really faint. Sometimes they will pass out. Cold hands and feet, like we're always told, oh, that's your thyroid. It may be and it may not be, right? Brittle nails, hair loss, so thinning hair, headaches, especially headaches that are related to your period, girls. Ladies, it may be an iron issue. Rapid or irregular heartbeat. And it can happen out of the blue when you're sitting on the couch doing nothing, watching TV, or doing your favorite thing in the world. You're just so relaxed, and all of a sudden, uh, rapid or irregular heartbeat starts to happen. Chest pain. Often with chest pain, it feels like a huge heaviness, right? Like something's just sitting on your chest. You can't get enough breath. Sometimes we refer that as air hunger. Cravings for non-food items, things like ice, wanting to chew ice, dirt, starch, anything like that. Like your body is really wanting something. And when you try to figure out what food it is, you come up empty. Okay. Restless leg syndrome. You guys, this is so central. If you have restless leg syndrome, please, please, please get your serum iron and ferritin tested. Okay. Difficulty concentrating or brain fog. Like almost, it almost feels like you're thinking through, like you've got cotton in there, right? And it's just so hard to keep a thought going. Sore or swollen tongue. Often this can feel like you almost feel like you're starting to get a cold sore, right? But then it doesn't happen. Cold intolerance, like you just don't want to be cold. It's a big thing. So I'm going to talk to you about what can be causing these symptoms. And it might not necessarily be the big, fat, hairy, scary things like MS, thyroid, heart problems. Yeah, you name it. It might be something as simple as low iron. So one of the things that we run into is, yeah, we all get our yearly blood work, right? But it's usually a CBC, CMP, and a urinalysis. They don't check your iron, serum iron and ferritin. You've got to ask for those extra. So if you're experiencing any of these symptoms, I highly recommend getting a serum iron and ferritin test done, even if you have to ask for it special from your provider. If you do not have a provider who will help you with this type of blood work, get a hold of me. I will help you get this blood work. This may be pivotal to you understanding what's going on with your body. Okay. So I want to show you blood work. This is blood work that I just got back. And low iron has been a kind of a thing for me. I thought I had it solved 2, 3, 4 years ago, but it's reared its head again. So now I am back into looking at what is going on here. So low iron is what I'm seeing in the blood work for myself. And what the doctor who did the blood work for me said was simply take X amount of iron every day, check back in 3 months and see if it's better. Great. I've been on iron for the last 5 months, and it's still very low. So I know that's not going to fix the issue. So y'all know me. I go into, okay, why is this happening? What is causing my body to do this? And this is what I do for my clients, right? You guys that have worked with me, you know, I'm like, okay, great. Your body does not do anything just for shits and giggles, right? There's always a reason. So we get on our little investigative goggles and let's figure it out, right? Our bodies are so good at helping us understand what's going on and why if we know where to look and how to ask. That's why blood work is awesome, but it's very surface level. We can't see whys in your blood work. Okay. We need to do deeper testing. And I'm in the middle of doing that for myself to really understand what's going on. So I'm going to show you my blood work. I just got this in this morning. And I want to show you this because often we think when iron is low, there's going to be like lots of clues in your blood work. Look at my blood work. The only red here is iron and iron saturation, right? My white blood cells look pretty dang good. Everything's just kind of perking along how it's supposed to be. This is my red blood cells, really looking at what's going on there. All of this is red blood cell work, white blood cells. We see the rest of those down here. Let's really look at what's going on. So my neutrophils are elevated a little bit, not clinically elevated, but on the top end. So I know that there's there's very likely a bacterial issue, maybe a parasite issue that could be driving some of this. I know that hormones are a little bit sideways for me right now. I also know because of testing and all that fun stuff, hormones are an issue. So again, why are hormones an issue? Right? So always asking why until you get to the bottom of it. So for me, right now I've got a parasite issue and I know that I'm working on that. Let's see. So nothing is red here, right? Nothing. I'm gonna make sure you guys are seeing this. Glucose is looking pretty darn good. You know, there's nothing that's like flashing red. This is out of balance or this is out of balance, right? Potassium is a little bit on the lower end. Liver's working great. Yeah. So look down here. This is iron anemia evaluation. So for example, if MCV, MCH, and MCHC were low or high, either one, we would want to be looking additionally at B12 and folic acid to see if there is not enough of that in my body. But those are fine. So it's iron, straight up iron. Okay, so now why is my body doing this? And I'll just kind of run down some of the most common things that I see in my practice. So one is heavy metals toxicity. That is a lot of times an issue when you have chronically low iron. For women, it is sometimes really, really heavy periods, and your body has a hard time building up your blood as needed between periods. Another thing is parasites. So it's a huge thing, actually. And this can be a player, both the heavy metals and parasites can be a player for male or female. Another thing that can really pull down iron is chronic bacterial infections, especially when we're looking, well, bacterial or viral infections, especially something that's been low laying, kind of in the background, that has become systemic and sometimes even started to show up in the brain tissue. This is why deep testing is needed. We need to understand why. When we know why, then we can address it, right? So I'm still in the investigative journey for myself, but I just wanted to share this with you because this is so simple. Um, Recently, I passed out on an airplane, so obviously they sent me to the ER, tested me for everything. Oh my goodness! But you know what? I mean, because I was not quite with it yet. When I finally kind of got started to get my wits about me again, I wanted to see my blood work. Right? They took a half a pint out of my arm, and I'm like, I want to see what's going on. And they didn't draw an iron or ferritin. I was like, I need that. We need to see what my iron and ferritin are. My iron was so low, it was surprising that I was still upright. So understand how iron plays a part. So iron is one of the integral parts of your red blood cells that helps to carry oxygen to the body. So when iron is very low, oxygen in the blood is very low. When that's very low, oxygen to all the cells in your body, including your brain and heart, are very, very low. So yeah, of course I passed out. But it wasn't a brain tumor, it wasn't a blood clot, it wasn't all the big things, it was just low iron. So guys, please, please, please advocate for yourself. This is a huge deal. If you've been experiencing any of the symptomology that I mentioned earlier, please ask your doctor, practitioner, whoever it is that you're seeing, to check your iron and ferritin. Have an amazing rest of your day. Take care.